I'm not wearing that visor.
Do you want to step outside to the window?
I can wait outside, that's not a problem.
Yeah, if you go and step outside then we'll have to speak to the commission.
That's absolutely fine,
yeah,
I'll do that.
If you go and wait by the window.
For fuck's sake, man. Hello. Hi.
I'm happy to see you today.
Yeah.
Everyone's going to have to wear a mask.
I'm not going to be able to wear a mask because I'm exacerbated just out here, and I've struggled just to walk down here. I've put off. Like I had the asthma pump yesterday. Got it. Perfect as soon as I got it. Right. 2 pumps. Took away the cough immediately overnight. I woke up this morning feeling a lot better. Oh, sorry. But as soon as I've got up, I'm feeling exacerbated again, and walking down here was pretty much a struggle. And I put off using it while I'm down here to be assessed properly. But I can't come in and wear a mask because that's making it worse. Every time I put on a mask, it makes it 100 times worse.
Okay, so one of the rules is that to protect everybody against catching COVID, to protect yourself and to protect me as well,
Okay.
we do expect our patients to wear a visor or a mask.
I completely understand that. But the visor does nothing, so there's no point me wearing it. And I completely understand you want me to use it, but it does absolutely nothing.
So we won't
It
be able
even
to
legislate, it even says that on the government website. It says it does nothing without the mask.
Yeah.
And I can't wear a mask. I'm happy to be assessed out here if you're able to do it.
I don't think that's an appropriate thing to do really, because we've got to examine you and talk to you, and so I'm also happy to see you, but it is going to be with a mask indoors.
So you're refusing me entry, or you're refusing me service without wearing a mask?
This has to be filled in.
Okay.
The practice manager said you've got to fill everything.
Okay.
So we can get you in the system.
I can do that, that's
Yeah.
fine.
Do you want to fill all that in as well?
part of
Yeah.
the rules that we do.
I get it's the rules,
Yeah.
but there's nothing under the law that says I have to wear a mask and I need medical attention. So are you going to refuse me medical attention?
I'm not refusing you medical. There are rules to.
I get there's rules, but it's not law. So I'm asking, are you refusing me medical attention?
I'm not refusing you medical attention.
So if I don't wear a mask, you will refuse me medical attention
I
though?
can't see you inside without a mask. No.
So you're refusing to give me medical attention?
No. I'm offering you to wear a mask.
I'm saying I won't wear a mask, so where do we stand with that?
Exactly. I don't know. I don't know how.
There is no I don't know. You tell me you're either going to refuse me medical attention. So you won't let me register and you won't let me be seen by a medical professional. So if I fill this out properly, you'll let me in to get medical attention?
Yeah, you have to sign all the forms, but you have
I
to
won't
wear
wear a mask.
Well,
We can't allow you in there.
So you're refusing me entry without wearing a mask?
I'm just saying that if you don't wear a mask, then we have to protect.
So if I come in, what happens?
Well, we don't.
You have to leave.
So you'll just
if you
ignore
can't wear
me?
a mask, you can't come in.
So if I go in then, what happens?
Well, you need to put a mask on.
If I'm not wearing a mask, I go in, what happens?
You need to come out.
And if I don't?
You have
Right,
to.
we're not
That's
being
our
difficult.
rule.
You are being difficult. You are being.
No, we're not.
we're not.
Because
I'm
we've got to
offering to
protect
see
the
you.
other patients.
Have you got a pen so I can fill this out properly at
I can
least?
go and pass you on through the window.
Okay.
Yeah. My colleague also said that you came in with a mask twice yesterday.
No, I didn't. I came in yesterday morning, I didn't wear a mask at all and there was no problem. I come in the afternoon, I get told I have to wear a mask. You can't have differentiating treatment between morning and afternoon. It's fucking ridiculous. Listen, I appreciate how you feel about it and I completely understand that, but I can't breathe properly and I've come down here for medical attention. You're telling me you won't give me any unless I wear a mask, which I can't breathe properly and I'm telling you that.
Yeah, but listen, just for now, could you just...
No, because I don't trust that you're not going to open the doors again when I'm out there. Because you're telling me you won't give me any service unless I wear a mask. You're refusing me medical attention without a mask and I can't wear one.
Could you just fill that out outside, just for the benefit of our patients? You've got a visor, we can get you a visor.
The visor does nothing and you know that.
This isn't just about you. you. This is about the safety of the staff and the
You can
patients.
say that all you like. You can say that all you like. There is no law that states I have to wear a mask in here. In fact,
There's
it
also
states...
there's also no law to say that we have to let you in.
There's a law that states that you have to give me medical attention when it's needed. And that comes under your code of practice as well. I suggest you adhere by that.
You have a duty of care too.
I have a duty of care?
Yes.
To who?
To all the patients and staff.
Do I?
Yeah.
Am I obliged to that? Am I?
Yes.
I've got that in writing, that I've signed that I have a duty of care to all of you and the public.
So we're not being...
I've even offered you to treat me outside. I know it's meant to be a private medical thing between two people, but I will happily take the treatment or examination outside if it helps. I'm trying. I can't breathe properly as it is, and I need a bit of help here.
We will offer you a visor.
It doesn't do anything. So what's the point in wearing a visor?
Because we have a duty of care to our staff.
And I think it's within the law to wear a mask.
Clearly what you think and what you know are two different things when it comes to law. I appreciate your medical training is much better than anything I could say. But when you're saying what you think when it comes to law is not the same.
So,
Can somebody please just help me fill this out so I can get it done quicker, and then we could do this quicker and I could be gone.
Well, why didn't you fill it out yesterday when it was given to
I
you?
did fill it out, I handed it over and she said that was fine.
No,
And
you
now
haven't
this
filled it
morning,
out.
yeah I know, this morning they're telling me that I haven't filled it out properly, which I appreciate, and that's fine. If somebody could help me make sure that I fill it out properly this time then
okay,
please.
we are going to have to ask you either to wear a mask or to leave the building.
I'm not going to wear a mask. I can't wear a mask, it makes it worse, I'm telling you this.
So we cannot see you in here without a mask or a
You
visor.
can, because I'm in
No, we
here.
can't.
No, we can't.
So,
So there's three choices: a mask, a visor, or you leave. And register. You can go register in another surgery. There is another one up the road.
So what you're saying, you're refusing medical treatment or
you're
service.
refusing to wear a visor.
So don't need to.
You do need to.
I don't need to. One of the
You
options
do.
I can't.
It's our
One of them I
policy.
don't need to.
It's
And the
our
option of
policy.
leaving, I don't have to leave. And you're not going to make me leave, are you? Are you going to force me out the door?
We can do.
Well, do it then.
okay, should we call the police?
You phone the police then. You're going to phone the police on somebody that needs medical attention. I mean, what the hell is this? What are you doing?
All we're asking you to do is to wear a visor to protect the staff. And
You're
we've got-
protecting your staff. Look at you, you're protecting yourselves. What's the problem?
We don't find this
Sake, guys.
comfortable either. but
None
we
of
have
us
to
do.
it.
I don't find this particularly comfortable. I can't even breathe
Control the
properly.
situation if you were to place the visor on.
You can remove that from me, please.
If you were to put it on,
I'm
you'd
not
resolve
putting the
the
visor
situation,
on.
otherwise
I'm not
it's
putting the
not-
visor on.
We can actually refuse to register you as well. We can deregister
We'll do
you.
it then. I've already been deregistered because I moved. I only realised that I wasn't able to get medical treatment in the other surgery because I'd moved. I didn't realise that. So I've come here to get help. I got told I could get help. I came in yesterday morning. I wasn't wearing a mask. Nothing was said. Nothing. And then I come back in the afternoon and I've got somebody different who's kicking off about it. And now I've got all of you kicking off about it.
Well, no, all we're asking you to do is to put the visor on. So you're saying you
For
came in
what?
here
What
with
does the
a mask
visor
on.
do? What does the visor do? Explain to me. What does that do?
It protects the other patient.
How?
Protect you, it protects
How?
everyone else.
How is that going to protect anyone? As soon as I walk past somebody, all the particles come out of it. No, you're being silly. You're meant to be medical professionals and you're telling me that's going to protect people.
And these are the rules that we've got to adhere to keep
It's
people
rules.
safe. Yeah.
If you went to the hospital, you would have to wear a
No,
mask. You
I've been
would.
to the hospital twice in the last 2 months with other people to help them out. None of them made me wear a single thing. They asked me, can you wear a mask please? I said, no, I'm exempt. That's it.
All we're asking you to do is to wear the visor so you can wear
You're
the
being
visor.
awkward. That's what you're being. You really are. You're being really awkward here. I've come here for medical attention. You won't help me feel this out. You're just telling me it's
I can help you
wrong.
fill that out. If you were to place this on, I can
She
come and
can't
help you
come
fill it
close
out.
to you. She cannot
You
come
don't
close
have
to
to
you.
come close to me. How about I just show you what I ask you what I need to fill out?
If you place
No.
the visor on, I can help you do that and we can get this resolved.
No, for God's sake, just
Right,
take
can
the
we ask
visor
you to
away.
leave the building
You can
then?
ask me all you like.
You can go to the reception, that's fine.
I've even come sat in the corner some away from everyone. I don't see how
If
that
you
is going to
place this
help.
on, well, if you could just comply with that, then we can help do that. We can get the whole thing resolved. Otherwise, we're going to go round
Just
in
help me
circles.
fill out the form,
If you
please.
Can you
place
put
the
the visor
visor on,
on
I
then,
can.
please?
I will not put the visor on.
Right, can we ask you to
This
leave
is
the building then, and
absolutely
we'll
pointless.
deregister you. And if you want
No,
to...
it's fine. I'll sit here and you can watch me just get worse and worse as the day goes on then.
You can't sit here.
Well, I can and I
You're
am.
compromising the medical care.
I'm not
of our
compromising anything.
patients.
You're actually compromising because you won't help me out and get me out sooner. I even said to you, can we do this outside for your benefit?
If you come outside,
And you've refused.
Well, if you want to come outside, I'll do the form with you outside.
I'm not doing the form outside. I'll do the form here, and a nurse can come out with me to assess me outside if that's how it's going to go down. I'm not filling this out just for you to usher me out the door and I can't get treatment still.
You can have treatment, but you're going to, the nurse is not going to be able to
Nobody's
close
going
you
to
without
see
a
you without a
visor on.
visor on.
Well, then we'll
They're
sit here then,
protecting
don't we?
themselves.
Then we're at a standstill, aren't we? And as much as you say you want to protect these people, you've got me sat here longer because you're refusing to give me medical treatment. I just think it's unbelievable you're going to find a place for somebody that needs medical help. I just can't believe
It's
it.
unbelievable
Well, it's
that you
unbelievable
just
that
put
you're-
this on.
You're actually doing this to yourself.
That's nice. Huh? I mean, do what you're going to do.
Right, you're alright to come in. Yeah. No, that'll be in here, and the caravan is for patients who are potentially COVID positive. So you're fine.
No, we're not that. No, we're not that. Sorry. It's blood. Yes, it's Vegas. No.
So did you not have to wear a face mask or a visor at your other surgery?
Not a single thing.
No.
This
You
whole
don't
time,
wear it in
any time,
shops or anything?
not a single time.
No, we're not
Honestly,
trying to be
people
awkward.
ask,
No.
and I completely understand that because, like you said, there's
But you
rules.
understand,
I
know
get
that-
the rules.
Yeah, we've got to have people wear these.
Yeah, I get you're asking. I honestly get
But I
that.
don't
But you
understand
know
why you do
yourselves,
this.
you're not meant to go beyond that. If somebody says they're exempt, they're exempt.
Yeah, I see what you're saying, but this is our rules, and you know we can't just bend
Your
them for one
rules
person.
don't supersede law. That's the problem. You're trying to impose things that don't supersede law, and I completely understand your rules. And I've even tried to help you, and I said I'll do this outside.
Yeah.
Do it in the car if you really want to. Keep it private away from people.
If the doctor would have to get close to you to examine your chest and examine your breathing, and they're not willing to do that without you wearing a visor.
It's up to them then,
patient's
isn't
for
it?
the whole
That is,
time
the
has,
funny
yeah.
thing is, your doctor, your nurse or your doctor there is trying to tell me that she won't give me medical treatment without wearing a mask. So I said, you're going to refuse me treatment if I don't wear a mask. She said, no. Because she's trying to protect herself legally, which is disgusting, instead of just giving me treatment.
But all we're asking you to do is to wear a visor, not a mask.
And what does the visor do?
Well,
Tell me what that does.
Well, it offers some protection.
What protection does it offer? Please, if you can explain it,
Well,
if you
if
can
you're
even give me some
breathing,
literature
it'll
that tells
stop
me,
any
because I
spit-
really
it'll stop
appreciate
any-
that.
It'll stop any potential infective spits landing on the person who's examining you.
I'm not spitting at
I know,
anyone.
but spit will come out of your mouth as you're talking, and if you raise your
Then I'll
voice,
turn.
or
If
you-
they're in front of me, I'll turn my head to the side.
And what happens when they got to examine it?
How do they examine me? They listen to my chest. They listen to the back as
And they
well.
have to get close to you.
Yeah. And as I said,
And that's
turn
why
my
they're
head to the
not prepared
side.
get close unless you're prepared to wear a visor.
No, because it doesn't do anything.
I mean, like I say, this whole
It's
situation could be
ridiculous.
resolved if
It
you
no,
could
no,
put
it wouldn't be
quickly.
resolved
It
by
would be,
that.
because you would be ushered in there, you'd be seen.
No, that's ridiculous.
In fact, if you'd have put it on already, you'd be in the chemist picking up your prescription if you needed one by now.
Well, that's fine. Instead, because you're trying to enforce something ridiculous like that, you can just watch me sit here deteriorate as the day
Well,
goes
no,
on.
because
Unless you want to get me removed by police, which
The
is
police
just.
no, the police people.
All right, well, fine then. I'll talk to the police then.
Well, would you like to wait outside and to talk to the
No,
police?
I won't. I'd actually really appreciate if you could help me fill out the form for starters, of which you don't need to come near me to help me with that. And you know that. You could just help me fill out the form.
Well, how can she fill it out with you?
I could pass it to you, and you tell me what I need to fill out. Literally what they did yesterday, because I missed out a bit yesterday, and they told me what to... was it yourself in the morning? It was. Because I missed that, I didn't sign it at the bottom, did I?
Sorry,
So you
did you
told
say you
me,
signed
and then I
last
signed it.
Yeah, it must have been, I don't know.
No, I didn't.
Because you were back here and
I don't know whether you-
came out as well.
I don't know whether you remember or not, because I'm not going to say you're lying at all. I don't know whether you remember or not, but I did not wear a mask. I was here without a mask. You didn't even... I don't even remember you asking. You might have asked, but I know I would have said I'm exempt because I wasn't wearing a mask.
So you were back in here.
Do you have cameras in here as well?
No.
Oh. I was going to say, you could have checked that.
You were back at the reception when I was leaving.
I was at the reception there, and I went round. Somebody came in as well who wanted to go to reception. I even went round to the side to make sure I wasn't near them as well. It's not like I'm stood here trying to annoy everybody. I'm trying to help a little bit.
But you're not, are you?
I am actually. You're not helping me at all by telling me to wear a visor that does absolutely nothing, or wear a mask when I'm suffering with my breathing. And you want me to put something over my mouth and my nose, which I know affects me really badly.
So you're suffering with your breathing, but you're absolutely talking fine.
Am I?
Yeah.
Yeah. Yeah, but you don't know how it feels like she's sat here right now. It gets better and better. I mean, I guess unless you're going to help me fill out this form, there's probably no point in you speaking to me anymore until the police get here, and they'll ask me out to do whatever they're going to do then.
I think you'll probably find that it's going to be the same whichever surgery you go to. They're going to insist that you wear a visor or a mask.
Well, this is where we're at then, isn't it?
There's a problem with you coughing now. Obviously, if you've got germs, they're spreading around here, aren't they?
Yeah, I haven't got germs.
Well,
how do you know that?
Because I've had PCR tests recently that would tell me I haven't got germs.
So, hopefully that you won't come back with a positive COVID test.
The thing is, if I'd been seen to,
Yeah,
and you listen to that, if you listen to that cough and you'd been, no, listen.
Refusing to wear the visor, all we're asking you to
If
do,
I'd been seen
you want
to and
somebody
you
to
listen to
examine
that
you.
cough, that is an asthmatic cough. It's not the cough of somebody that's sick with a bug. That is somebody that's got an asthmatic cough. And somebody assessing me would know the difference.
Okay, thank you.
You sure?
Let's ask, why is this different to yesterday? Like I said, I don't know if you remember or not, because obviously you have a lot of people passing in and out here. I was in there without a mask, and we didn't have any real conversation about a mask or a problem. I don't understand the difference.
You can see all the signs. If I haven't picked it up, you should have been wearing a mask, because you can see them.
Why would you not pick it up though?
Sorry?
Why would you not pick it up?
I don't know. I assumed you were wearing a mask. If I had to think back, I would have swore that you were wearing a mask, but you're saying you weren't, so... Like you can see, you can't get away from the fact that everybody should be wearing a mask when they come in here. You
Yeah,
can see
unless
everybody who is coming
unless
in
they're
here.
exempt. And we
But
know
that's why
that.
we have the face shields for people who are exempt, and I understand.
The face shields aren't for if you're exempt.
But people
That's
who,
to comply
but people
still.
Who can't wear them, they can still wear a face shield because there's no reason.
But
why
if you look on the
couldn't.
government website, it says
all
the
I'm
face
saying
shields do. No, I know what you're saying, but the face shields do nothing without the mask.
Well, all I'm saying is.
That's literally what the government
yeah,
says.
But we could resolve this situation if you
That
put
is
on the face
resolving it.
shield.
You go by government guidelines, not your own.
Please civilise now.
Are you okay?
Yes, yes. I think my colleagues called you.
Oh, right, okay.
Yeah. Did Caroline call you or Peter?
I haven't got a clue who it is, no.
Oh, we were just having an incident with the gentleman. He's got an appointment to be seen, but he wouldn't put a face mask or a face shield on, so the GP or the AFP wasn't able to examine him.
Right,
So
okay.
then he was refusing to and also refusing to leave, and he's got a cough.
It's an asthmatic cough. That's what I'm here for.
Okay. Legally in Wales, you have to wear a mask, okay? Unless you're exempt for wearing one, and that's for medical reasons.
I am exempt.
Okay. Do you have any sort of identification that would identify that you are exempt from wearing a mask?
Am I do I have to have one?
Not necessarily, no, but
I've even said to them they can assess me outside. You know, I've even said to them they can assess me outside. So the point of me coming down here, I had to get a new asthma pump yesterday, of which I came in the morning without a mask and there was no issue. I'm struggling to breathe. The asthma pump they gave me yesterday has helped overnight, but I've come down here to be assessed with an appointment. And I've come in again with no mask, and now it's an issue. I've said to them they can assess me outside if it helps, but they're refusing to assess me outside. They're refusing to let me be seen unless I wear a mask. Or, I know they're saying a visor, but we know the government says the visor does nothing unless you're wearing a mask, so it's absolutely pointless. I just want to be seen. They're trying.
If that's their conditions of entry, that's.
But it doesn't supersede what the government guidelines say, and the government guidelines say the face visor is pointless without the mask. If you're exempt, you don't have to wear a mask or a visor. I've said I'm exempt. I don't know what more proof they need for medical exemption. The fact they've got my medical records right there, it says I'm asthmatic.
Right.
And I'm right now heavily asthmatic.
We don't have your medical records yet.
Well, you do, because you have my what is it, national health number or whatever it, NHS number. They've got that. They've got my whole history.
But if that's what they require you.
That what they require does not supersede what the government says.
But if it's their policy, that's their policy.
It doesn't matter what their policy
It's
is.
accepted them if they want to.
They can't enforce policy. It's not
They can't.
law. It's not law.
But if you want to be seen, that's what you have to wear.
Well, then we're at a standstill, aren't we? I'm not doing anything wrong here, am I? Am I breaking the law at all? I don't understand why you're here.
You're not breaking the law. We're here to prevent a breach of the peace at the moment.
Am I breaching the peace?
by refusing to leave, yes. They've asked you to leave.
I'm breaching the peace.
By refusing to leave, yes.
Am I?
Yeah.
Can you detail to me what the breach of the peace is?
We're not going to go over this. No.
Why? You're supposed to know that. You're saying to me I'm breaching the peace, which is it a criminal offence? Is that a criminal offence? I'm just asking because you're here obviously to do with law.
We've come here because not just partially because allegedly you're not wearing a mask and you're refusing to leave, but apparently you've been verbally abusive to all staff as well.
Would somebody like to substantiate that? Can
somebody
somebody would anybody like to stand up and say I verbally abused them?
No, that's from the initial call that
that's
we've had.
That's the call that we've had.
If somebody here said that, that is disgusting.
Calm yourself down for a second. You just speak to this lady.
That's not fair. That's really not fair. I haven't verbally abused anybody.
You asked him nicely to wear a mask. He said you can't wear a mask, so he said please wear a visor. You said the doctor or the nurse cannot examine you without a visor on. He's refusing. They said, well, it's our policy for somebody to either wear a mask or a visor, which is going to be the same policy he's going to find in all the surgeries.
Yeah.
Of which all the surgeries have never done this to me. They've asked me, can you wear a mask? And I said, I'm medically exempt. Because obviously I have my records as well. And there's not been any follow-up. I've been to the hospital, same thing.
Hospital's totally different to the GP surgery.
Well, you said to me earlier the hospitals would do the same. And I said they didn't.
We've had
So now you're telling me it's different?
Saying that people have got to wear, it's the same when you go for your vaccination. You're not allowed to wear the fabric mask, you have to wear a blue mask.
Well, I haven't been for a vaccination. I don't know that there. I haven't been there.
You haven't had your vaccinations?
No. Is that an issue now?
No. But like I say, we have a duty of care to our other patients. We have a duty of care to our staff.
Yeah, I appreciate that. And you're wearing your
Well, no,
masks and you're doing everything.
Because I'm exempt.
Because I'm exempt. You've literally said unless you're exempt.
You said exempt from a mask. You haven't mentioned a visor.
I'm exempt from the visor as well then, because it's the same thing.
It's not the same
Yes,
thing.
it is. It falls under the same guidelines.
So we cannot expect a doctor or a nurse to examine you and get that close if you're not prepared to wear a visor.
Well, unless the doctor, of which she wouldn't say explicitly, she will not treat me. She evaded that question, because I repeatedly said to her, if I'm not wearing a mask, will you not give me treatment? She says, I'm not saying that. She refused that, so she's actually not refused treatment, because she won't refuse it. And I know why she won't refuse it.
If you're refusing to wear a
So
mask
they're not
or a visor.
actually not refusing me treatment. So I still have my appointment. So I don't understand why you're here. And again, I haven't been abusive.
No, I'll clarify that. I've got that wrong.
I was upset about that, because that's not fair.
Something's been translated to our control room and they've told us there's someone being verbally abusive. She's just confirmed you've not been verbally abusive whatsoever, and that's completely wrong information, so I apologise for that. She did say that you've raised your voice and you're frustrated, yeah, when you've scared the other patient by raising your voice. It's going to happen though, isn't it?
I've sat round here. When I came in, I even sat round the corner.
If you're going to be raising your voice...
You didn't have to. You came over and you made a thing of her. She didn't come to you. You came over to her. I saw what you did. I asked you before if you had cameras, because yesterday I came in here. Yesterday I came in here, and as I said, didn't have a mask and there was no issue. And I asked you if you had cameras, because you don't remember if I had a mask or not. And it would have helped corroborate that story, essentially. I wish you had cameras in here, because it would have shown you've gone over to her and moved her. She didn't ask to be moved. You're creating a problem.
No, you're creating a problem. We've asked you nicely.
No, because I've said I'm exempt, and you've said yourself if you're exempt, it's okay.
I didn't say that.
Right, so,
is it okay if I'm exempt?
Hold on for a second. We are getting absolutely nowhere now.
No.
Right.
No, exactly.
As your policy, what does your policy say at the moment?
Our policy is if you cannot wear a mask, then you can't come in unless you can wear a visor. So it's one or the other.
Have you tried wearing a visor?
No, he hasn't.
Why haven't you not tried?
Because the visor is absolutely pointless. It's ridiculous. No, I completely understand you know, you'll try and get people to bend to that wheel of just wearing a visor, like just do that. I'm not doing it. Can we just stop playing these silly games and just get straight? That is a silly game.
COVID is not silly, is it?
No, it's not silly. No, COVID's not silly, and that's why I understand you're wearing the masks. But it also states if you're exempt, you don't have to wear one. I've said I'm exempt. There is no more possible proof of showing that you're exempt than having my medical records right there. And as much as you say you haven't got them, you've got my number, my NHS number, whatever it is, my details. You can look at my whole back history. I've got my asthma pump with me. When I got down here, I wasn't breathing properly.
If you're at risk, then you would be more willing to help yourself.
But that's my choice, isn't it? That's my choice.
And our choice is that you...
Not as medical professionals, because you're meant to see somebody when they need medical treatment.
But
Are you not?
Not without protecting our
Are you
staff.
not? Are you not supposed to see somebody that...
Not without protecting our staff. Our staff need...
Are you not protecting yourself? Are you not wearing a mask?
If you have your keys, it's blocking into workers. I'll go with it.
I completely understand, like, what you're saying, but you're contradicting yourself constantly. And all I need is somebody to treat me. And also, I've asked somebody to help me fill out this form, because yesterday when I filled it out... No, you don't. No, you don't. Yesterday when I filled this form out, I thought I'd filled it out correctly. I passed it across, and she said, "Oh, you've missed this bit out." Told me what I missed, and I filled it out. Today they're telling me they can't do that. They're just completely refusing it without telling me they're refusing it. And I don't know what exactly you're meant to do.
Okay. Nobody's going to come close to you, obviously, because they fear for their safety, aren't they? Because you're not wearing a mask or a visor.
Okay.
So, I don't think you're going to get the help to fill the form out unless you do wear one, to be honest. Are the doctors refusing to treat him with...
No, they're not. They're not explicitly refusing to treat me, unless she stands here and tells me she's not going to treat me, because she hasn't. She said, unless you come in with a mask, we can't let you in. So I've said to her, if I don't wear a mask, are you not going to treat me? She said, I'm not saying that. She's just going around in circles and evading actually saying it.
And all we've asked you to do is to wear a mask.
And it's confusing and it's ridiculous. And I could have been seen by now.
It is confusing, but it's not ridiculous though, is it? Because we are still in Wales, we are still social distancing and we are still wearing masks. I know it's different in England. Yeah, it was difficult for me. I've been off for 2 weeks. I went to Liverpool and it was totally weird seeing people not wearing a mask. For me personally, I still wore one. Yeah, but then I got comfortable towards the end and I stopped wearing it. But coming back here, you have to wear one, don't you?
Unless you're exempt.
Okay.
Which I am.
So you're saying that your medical records prove that you're exempt?
And the fact I've got an asthma pump with me, I've come down to see the nurse about my asthma. That's a medical exemption. I couldn't be closer to it. I don't understand. And I completely understand what you're saying. I know it's a difficult situation for all of you. But you stood there telling me I can't get treatment.
No, we're just asking you to wear a visor. That's all we're asking.
Otherwise, I won't get treatment.
They're not telling you.
Our policy is for somebody to wear a mask.
Are you explicitly telling me right now? Are you explicitly telling me?
I'm not the doctor, so I wouldn't be coming anywhere near you.
Bring the doctor out. So that she can, from a distance, she can explicitly tell me that unless I wear a visor or a mask, she will not give me medical treatment.
How can she examine you if you're refusing to wear a visor? Because she's not going to get close to you.
So if she gets close to me while I'm wearing a visor, how does that stop?
Well, it offers her some form of protection.
Does it?
That's all we're asking
You said
you
if I'm spitting, which I won't be spitting when I won't be talking.
You've just been coughing everywhere. You've coughed all over your hands. You haven't used any sanitizer.
Right.
Okay.
What about this? Okay. You've specifically said that the visor won't make any difference, but if you wear it, you'll be treated.
For the sake of 5 minutes.
What difference does that make to?
Because I'm not going to wear something. It doesn't make any difference at all or any sense. Just to wear it, just so that I'll be treated. No, that's them imposing something. Hold on, that's them imposing.
Stop talking over me.
Don't talk to me like that.
Stop talking
Don't
over
talk to me like that. I'm telling you now, don't talk to me like that. That's not how you're supposed to talk to the public.
Absolutely round the circles now, aren't we?
Yes, we are.
Yeah.
Because it doesn't make any sense.
What difference does it make to yourself by just wearing that?
What difference does it make me not wearing it if it doesn't do anything? Because have a look at your own. Have a look at your own government guidelines. It says that visor does nothing without the mask. So tell me how that makes a difference.
Right, okay.
They're imposing something on me that is not imposed by law, and they're making up their own rules.
We're not making up our own rules.
Yeah, you are. You tell me to wear that, otherwise I won't be seen.
Nobody's imposing anything. What they're saying is to get treated, you need to wear that.
That's imposing something, isn't it?
No, because you don't have to be treated, do you?
Are you sure?
It's your choice to be here, isn't it?
No, that's not how it works. It's not how it works. When it comes to doctors and nurses, under their own oath, they're supposed to treat people when they need medical attention, even if you're not registered to a surgery, by the way.
Yeah, but the conditions of entry here are that you wear a visor or a mask.
Unless you're exempt.
Not the conditions here. That's the policy.
Yes, they are. By law.
Local policy is
By law. By law, though, right?
Yeah, but then they.
So if I'm not breaking the law, why are you here? Apart from, I understand what they said about breaching the peace.
Because we've asked you to leave and you're refusing to leave.
But am I breaking the law by doing that?
You're not breaking the law.
So what's the problem?
But their conditions of entry are that you have to wear those to be seen.
Is that law?
No, it's not law.
So why are you here?
To prevent
Not to be rude to you, I do apologize. That sounds really rude, and the way I said that sounds really rude. But why are you here if I'm not breaking the law, and we've established
Surgery
that?
of asked for assistance of the moment.
Okay, well, I don't think you can actually help, if I'm honest.
We can't.
You could by actually convincing them to actually see me like they're supposed to, or at least get the nurse or doctor, or at least get her to come out here and say explicitly she will not treat me, because she hasn't done either.
The thing is, you only registered yesterday. This is not getting off on a good start at all.
No, it's not. It really doesn't look good on you guys.
No, it doesn't look good on you either.
That's fine. But I'm here to get treatment and you're refusing.
We're asking you to wear a visor.
And I said I'm exempt.
And we're asking you to wear a visor.
It's not going around in circles, by the way. It's literally, that is the end of the road. You ask somebody, can you wear a mask or a visor? I say I'm exempt. You say, okay.
You're the only one that's actually refused to wear a visor. We have lots of people who say they can't wear masks.
Do you know what's worse than refusing to wear a visor? It's refusing somebody medical treatment when they need it. That's horrendous. That is horrendous. I can't, and then calling the police on them. And I don't know if you guys put across that I was abusive to the staff or not, but calling the police on somebody like that alone is horrendous. I can't believe that people like you working here that would do something like that to somebody that needs help.
But the thing is,
And then make them feel guilty for it.
But you could
What's wrong with it?
yourself by just putting the visor on, and then this would be a problem.
Well, it's funny because yesterday you didn't have a problem with it. And now they've all come out with a problem with it, and you've got a problem with it. But you're saying you don't remember yesterday if I had a mask on. It's very convenient. I'm not saying you're lying, but it's very convenient.
Well, I would assume that you'd have had it on, but there's a lot of papers on the screen and we're trying to deal with people's...
But you look directly at me.
But that's why we have the glass there as well, to put extra protection.
Yeah, it's extra protection for you. You've already said that. You're protecting yourself, so I don't see the problem.
Well, when we're behind the glass, there's extra protection, isn't there?
And now my concern is they're going to try and find something else now that they're here to take me out on.
Well, it's only going to go one way. They'll have to remove you, or you can put the visor on, isn't it? You can't sit here all day.
If they have to remove me, then they have to remove me. But I'm here for medical treatment.
Yeah. Well, that's a shame, isn't it?
Yeah, it really is.
Okay. Yeah. Yeah. And obviously for yourself, you're not protected by having your COVID jab either, so you're making yourself
That's my problem, isn't it?
Yeah. Well, no, it becomes our problem because then you'll have to be treated in hospital if you do.
Well, the longer I'm sat here, because obviously there's other people come in with various illnesses, the longer I'm sat here, the more chance I'll get something then, I guess.
Yeah.
But you're not letting me be seen.
Yeah, you put yourself at risk.
So it's my fault that I'm not being seen.
Well, it is.
It's my fault that you're refusing me medical treatment.
Because you're refusing to wear a visor.
Because I'm exempt. So you're refusing yourself to obey the laws that have been laid out for you to use. You're refusing to go by those laws and make up your own policy that is not governed.
But the police did explain to you because it's our policy.
Well, they have, and they haven't removed me. I haven't been arrested for doing anything wrong, but you're still refusing. So this is clearly on you. It's you guys making a certain decision. So stop trying to put it back on me. Just stick by your guns. You're just saying, this is our policy, which is how I treat it. Stop trying to make it sound like I'm a problem. The annoying thing is, I was putting off using this so that she could assess me properly, but now I'm going to have to use it.
I don't think you're going to get a GP or a nurse who'd be happy to assess you.
Well, I have had. Yeah. It's just unfortunate that... do you know what the most unfortunate thing out of this, as far as I can tell, is that I had to change surgeries. Because this is clearly not the surgery to be at.
The thing is, if you're out of the area, you have to move to a GP surgery in Hollinghead.
Yeah, exactly. But that's the thing, I've got no choice but to come here. You're talking about choice.
You can wait at the desk and the girls will be with you when they get a chance.
Do you have a prescription registered with Jones, please? Previous collaboration. Brilliant, thank you.
I spoke to the doctor.
Yeah.
What they've said, because there's patients in here that have got immune system issues, that she's not willing to see you unless you wear a mask or a visor.
Well, unless she comes out and tells me directly, I can't accept that.
She's not willing to because she's asked me to pass the message.
But she's explicitly saying
and
she's refusing me treatment.
Unless you wear a mask or a
Even
visor,
though
she cannot see you tears.
Even though I'm exempt, she's refusing me treatment.
What she said.
Well, I do need to hear it from her, because I appreciate that's what you're saying, but she can't scapegoat.
That's what she said to me. I'm passing the message on.
Well, because legally I need to hear it from her. Because this will go down a very different route if she actually says that. And like I said, I'm sat here waiting for my appointment.
I'm passing the message on. That's the message what she's passed on to me.
Yeah, oh yeah, you can jump in. Oh yeah, I was going to say you can jump in at the desk.
Yeah. I've got blood 10:15. That's it, yeah. Yeah. That's fine.
Yeah, you're okay. See you tomorrow. Bye. Thank you very much for that. Okay. I just want to ask Jane if I need to do a prescription for this. Sure. Oh, right, that's okay. I haven't seen her, no. From here, okay? You can come in. Come in. Hi, you okay? Chanel. Oh, you're dropping it off, yeah?
Yeah, she just asked me to drop it off before we
Oh, yeah, no problem. Oh, sorry, I'll put it in the bag. Thanks.
Right, this is where we're at. We're leaving. I'll level with you. Didn't think so, to be honest, but we've got no powers. You know what breach of the peace? Do you know what breach of the peace is?
I don't know the full.
Okay, so
that's why I asked you.
Yeah.
I need to hear the definition if that's what's going to be put to me.
Don't ask me about definitions. I won't remember them off the top of my head anyway. But
I appreciate that.
Definitions for breach of the peace, basically, it's a fear of harm, fear of violence, and fear of disturbance.
Okay.
There's none of them.
No.
You know, you're calm, compliant, understand you've been argumentative with them. Understand you're asthmatic. Yeah, but we've got no powers whatsoever to actually get hands on with you. We can't, unless you became verbally abusive towards us, then boom.
Which I would never do.
You haven't, no.
No, I'd never
you don't
do
seem
that.
like the sort of person that would.
I don't think I'd be strong enough to do that at the minute.
No.
Anyway.
We're leaving, okay? I've advised him, if you start to kick off, which I don't think you will, if you start to raise your voice, whatever, and start swearing towards them, then we will be back, and then potentially we will have the power to arrest you and to remove you lawfully, okay? Now, you're going to be wasting your time, I think, just sat there now with that mask, or even a face shield on it. I've just spoken to the doctor and I'm speaking with him. What can we do to resolve the matter? What can we do? He is asthmatic. What can we do to get him looked seen, get him treated, get him out of here? Yeah, so other patients.
Yeah, because I said to her, just get me out.
Yeah,
just
so
see me and get me out.
At the moment, they have moved all the other patients. So they're accommodating you now by moving. There's elderly people there. There's more people coming in. They won't be allowed to sit here now because you're here with that mask on. Simple as. So you are now disrupting the whole GP by refusing to wear that and by refusing to wear that. And my point earlier, and I do apologise if I came across as being a bit prompt with you, but the point I was trying to make is, if you think that will not make any difference, yeah, that's fine. But in hindsight, it will make a difference to them because that's their policy. So by wearing that, you'll be treated, and this whole problem will just go away. Simple as.
I understand what you're saying.
Otherwise, you'll be stuck in.
I understand completely what you're saying, but it's a huge issue
for yourself,
for everybody involved right now. Because if
I think you can come in.
don't get me wrong, I'm as concerned about my health as anybody should be, because I know how bad this can get if untreated. But I know so many other people that have had this same issue where they won't be treated for something as simple as that. And it gets worse from there. They're making up their own policy, which goes against government guidelines, okay? Now, I completely understand that you could say, just go with it, do it, get your treatment or whatever. I've done that in the past as well, and look, here we are again. What I'm saying is, if they can make up these policies, they're going to make up whatever they like.
Okay.
And I thought we're supposed to be here enforcing law, and anything that isn't governed by law, if they make up their own rules that stops me getting medical treatment,
Okay.
Because that's what I don't understand. So the other thing, I appreciate what you said completely. The problem is they're supposed to adhere to their. If they're telling me they have their rules and their policy, their own rules and policy states they have to treat people.
Yeah.
And if they're saying unless you're, you have to wear a mask for us to treat you, unless you're exempt. I've said I'm exempt. I can't prove it anymore that I'm exempt, but they're refusing me treatment. So where do we stand on that? Because as far as I'm concerned, they're breaking their own terms and guidance, which they're governed by law. So why aren't they being told right now, you need to treat this person? You can't leave him sat there sick.
Well, I've already explained to you. I've already discussed that with him, and I can't.
I know you can't physically force them to do it. I get that.
To treat you, that's their policy. I don't think they're making anything up, mate, because I'll be honest with you. My partner, she's a nurse. This is governed, and this is policy. And it's supposed to go in the back way.
It is governed. Yeah. You're absolutely right. It's governed, but so they're not following the government guidelines. Okay. Because it clearly states wear a mask unless you're exempt. Okay, and the visors don't do anything unless you're wearing a mask. It literally says in black and white. Exempt. Sorry.
So we need to prove that you're exempt. That's what you're saying, basically, isn't it?
And they can prove it.
Okay.
I tell you what, I could prove it because I was waiting to see the nurse. I put off using it. I put off using my asthma pump to see the nurse so I can be assessed properly, so she can hear what my lungs are like when I haven't just used it.
I'm going to tell you in front of the police and in front of the practice manager what I'm prepared to offer you. If you won't accept this, you're going to have to leave. Okay? I will see you in the cab out the back, because you're not coming into the clean area back there because you're putting other people at risk by your behaviour, which we have to say, from our point of view as a practice, has been appalling today. We're not.
That's your opinion. Yes, I don't appreciate that. No, I don't appreciate you saying that. If you're going to come out, I'd rather you just come over and tell me clearly what your procedure is, what you're going to do, instead of projecting to me what your moral standing is on me for my behaviour.
It's my opinion. And I'm just telling you, we won't be registering you formally, but we'll see you today as a temporary resident.
And you'll fully assess me for my asthma right now?
I'll listen to you and look at you and say.
You'll do exactly what you would have done in there if I was wearing a mask out there?
Yes. But if you're not happy with that, you can go up to Longford Road and Canberra Surgery and be seen up there.
I said earlier, I'll happily do it outside. I'll do it wherever you want to do it. I don't see the problem. Okay. So I'm happy to do that, as long as you're going to give me the full assessment that I would have got.
Now's the time to right. Sir, thank you very much. We'll get that done. Yeah?
Yes.
Sorted. There's no need to go on and say anything else. Is that okay with yourself? Outside. Yeah. There we go then. Okay. Leave it at that.
Okay. So I guess I don't fill that in now.
No, you don't fill that in now.
So you're refusing me registry as well?
We're seeing you as an immediate necessary patient. We think the behaviour here today has been, as I said to you, I'm quite happy to repeat it, I think your behaviour has been appalling today.
In what way?
In the fact the difficulty you cause for staff, the risk you're putting other patients at, it's not appropriate, and it's not appropriate for a medical centre, I'm afraid. And you need to understand.
It's a shame that you feel that way. I'll say that.
Right, look forward. Do you want to go at the back, and then once...
You can meet me at the back.
Yeah, we'll meet you at the back once it's clear here.
Yeah, tell me how you want to do it, because I don't want to walk through all of you and everything.
Just get his patients in first.
That's right. Because like I said, I went outside earlier as well. I've tried to help out a little bit. It's not like I've stood here, just sort of stood in everyone's faces and that, refusing everything.
I think it's both sides, as you see, and she's in a camp, but she hasn't got a topic. I didn't.
Yeah.
Oh, sorry, I didn't think. I seem to think it was on both sides, and my mom's in the state, and she hadn't a copy, but...
Okay, shall we go outside?
Yeah. Do you want me to leave that there?
Yeah, just leave it
leave it there.
Okay.
No, I'll get it now.
Thank you.
And you want us to...
Do I go?
Yeah, I think that's like... he'll have gone to get his medical equipment.
Okay. Can I say, I really appreciate how you guys have been as well, because I know it's not a difficult, it's not an easy situation for anyone.
I understand that everyone's put in a difficult position, you know, everyone's stuck in the middle. Like, we don't want to be wearing masks. The workers here don't want to be wearing one either.
No.
You know, I can appreciate that you're asthmatic and you prefer not to wear one. You know, I understand. It's just have to meet in the middle, yeah.
I know. And it's not often I put up principles in front of my health, but some things I can't stand for myself, and I appreciate that you some disagree as well. I appreciate that. It's just literally just to get medical treatment, and like I said, I've been to the hospital, I've been to other GPs as well, and they've been absolutely fine as soon as I say I'm exempt. I know some prefer you to have like a lanyard or something. But there's nothing that says you have to wear it. I was trying to hold in any coughing as much as I could in there. I didn't obviously want to upset other people coming in. How would you like me to do this? Sit down?
Yes, please. How can I help?
Sorry. So yeah, picked up my asthma pump yesterday. It instantly helped and risked an actual half an hour's sleep. But as soon as I got up this morning, I'm short of breath again. And walking down here was a real struggle. Got asthmatic cough, sounds like a squeaky toy after a couple of minutes.
Okay. And have you taken your inhaler again this morning?
Yeah, I took 2 pumps this morning at about 8:30, and then coming down here I tried to hold off using it so that, I don't know if you assess any better sort of thing, but I've used it in the last 10 minutes in there. I took 2 puffs.
And has that eased your symptoms?
It did for a moment. It does have instant effect, it's just, it doesn't last particularly long.
How do you take it?
Sorry?
How do you take it? Is it just as straight into your mouth, or do you use a spacer?
Straight into my mouth.
And is this all new symptoms, or are they?
So it started sort of midweek. It mainly, it was the heat wave that we had over that weekend, sort of really took a toll on me. And then I got a bit run down from doing a lot of working hours and stuff, and my asthma just flared up really badly.
Okay.
I can go most of the year without using it, but then suddenly when I do need to use it, it's quite bad.
And which pumps have you been using? Just the blue one?
Just the blue one. I have been given the brown one before. Is that the preventer?
Yes.
When my asthma comes on badly, I normally get given that. Or I also get assessed to make sure I haven't got a chest infection sort of thing, because then I normally have a course of steroids or something.
And we need to listen to your chest, so do you mind taking your jacket off, please?
Yeah.
So when was the last time you used your brown inhaler?
It's probably a good couple of years now.
Okay, so remain standing and then... Okay, that's fine. Any sense of smell?
Yeah, the sense of smell's fine.
Okay. It's probably that your asthma isn't well controlled.
Mm-hmm.
Okay, you probably do need your brown inhaler now.
Okay.
I will give you another one of those today. It's better used with a spacer.
Okay.
You've got the Clenil 100. Okay, so I will do you another one of those. It's going to take a few days to start working because it's a steroid.
Yeah.
And the spacer will hold it in the drug in the spacer, and then you breathe in normally 5 breaths. Okay.
So I see. So you pump it and then you
then
just breathe within that sort of thing. Okay.
All right. So I'll do you. So you had a prescription yesterday for salbutamol, is that right?
The blue inhaler.
Yeah.
Yeah. So I've
So
got
we
one
just
of
need
those
that
now.
one.
Yeah.
I'll go and do that for you.
Is it possible to have a spare blue inhaler as well?
You had one yesterday.
Yeah, it's the only one that I do have.
Okay, so you don't normally, I mean, you should just manage with just the one, so.
Yeah.
Should we stand you outside? I will bring the prescription out to you.
Thank you. Thank you for sorting it out in the end. Can I just say, I don't know whether you'll pass this on or not, but the doctors and nurses in there that refuse to treat me, I have to say are a disgrace to the profession.